Hello, everyone. Thank you for joining us for this HidMed Chat, a special Let's Get Vaccinated HidMed Chats crossover episode with March for Science. And today we're really excited to have Hood Medicine's pediatric advisor, Dr. Yancy, with us again, joining us for a quick Q&A to answer all your questions on kids' vaccines and booster shots, COVID vaccine approval for infants and toddlers, and to review some of the new studies focused on assessing the impacts of long-term COVID in children. My name is Dr. Yancy Hudson. I'm the chair and science director of Hood Medicine Initiative.
I am Jonathan White, co-founder and director of policy and engagement.
My name is Doug Slaughter. I'm the public health director.
Hood Medicine Initiative is a collective of scientists, physicians, hackers, and assorted geeks focused on addressing health disparities in Black and Brown communities and reducing the spread of dis and misinformation.
HoodMed Chats, our signature event, is an effort to bring the expertise of healthcare professionals and others to those communities. Our goal is very simple: help us, save us. Today, we are extremely honored to welcome back Dr. Yancy, a dedicated pediatrician who has been practicing in the inner city of Indianapolis, Indiana for over 30 years. Dr. Yancy began his practice as a resident in newborn intensive care unit of Indiana University Medical Center, James Whitcomb Riley Hospital for Children, the first African American resident at the hospital. He was named Chief Resident of Pediatrics in 1979. He is the Adjunct Clinical Assistant Professor of Pediatrics at Indiana University School of Medicine and a fierce advocate for the health and wellness of his community. I have a slight correction. He's been practicing for over 40 years. And I like to.
We're not trying to make you feel old now.
Right. That's okay. I'm happy about that.
I like to refer to him as America's pediatrician because he is one of the best physicians I have ever spoken to. And I'm just delighted to have him back.
Thank you. Thank you. Yeah, that from the 30th to the 40th year, that's been a lot. So a lot's happened during that time.
Right. We're happy to have you back to answer some lingering questions people may have about getting their kids vaccinated for COVID. But we wanted to give you a chance to share your new book with everyone. It's called Cottonmouth. Can you tell us a little bit about that before we begin?
Oh, sure. It hit me last year. I love to write. I love to write. Oh my goodness, I didn't see the graphic up there. I love to write. And so when the pandemic first hit, I actually did a quick post about someone who had gone to a store and people were not masked or distanced or whatever, and someone actually got COVID from that. So and this post got about 680,000 hits to it. So I was thinking like, oh, well, if people feel that way about it, maybe I'll just write a book about somebody who gets exposed and how it affects their family. So I did, and I put together this fiction novel about this professor, this retired professor who has done everything possible to keep his family safe, but somehow the virus still impacts his family anyway. And what he undertook to kind of deal with that situation without giving any spoilers. But one of my mottos is that sometimes a broken heart bleeds venom. And so he actually undertook a way to try and rectify the situation that's horrifically affected his family. So it's, like I said, it's called Cottonmouth. It's a fiction novel about, I call it a love story, but it's a love story with a bite. Available on Amazon and Barnes and Noble and bookshop.org.
Cool.
And Target. So thank you.
No problem. We will drop that link in the chat for people. I just wanted to give you a chance to tell us about your outlook going into the holidays and how important it is to consider the life-saving benefits of vaccination, especially with the Omicron surge looming. So what do you have to say about that?
Sure. One of the things that has actually troubled me quite a bit, and before I get into the actual kind of like science stuff of it or whatever, is that we've heard a number of people say, well, not that many children get seriously ill, or just a few children die, or, just a few children will have, serious and horrific side effects or whatever. And so I've always been intrigued about how many children is enough to create an interest in the threshold of that. So is just a few children dying, is that okay? Is just a few children getting, serious illnesses and all sorts of organ failure, is that okay? And so when I look at it that way, children should not be dying from preventable things. So as the holidays come in, and we have a number of children who can't get immunized, I think the best way to protect the children from catching a virus that is potentially deadly. We've had a few hundred deaths in the country, somewhere between 400 and 500 deaths. We've had thousands of children with a particular inflammatory syndrome where their organ systems can, in fact, become very inflamed and can shut down. And we've had some that we don't even know the consequences yet, where they are still experiencing long-term problems. So I think it's well worth trying to get rid of. And so I would say we have to keep the children as safe as possible. And that's by everybody in their circle, everybody that's around them, getting fully vaccinated. And that will decrease the spread and decrease the ability to transmit to the children, and keeping them as safe as we can in that way.
Dr. Yancy, welcome back.
Thank you.
How have things been going with your pediatric practice since the kids announcement?
I've been, I always like to paint a good rosy picture, but to be honest with you, I've been somewhat disappointed. I've been disappointed in the number of individuals who have not gotten it and who just don't plan to get it. And I've certainly been able to convince quite a few, as some of the questions come up that are hesitant, questions that they have. But the numbers so far, I'd love to see like a good 90% uptake, 90% acceptance. I don't have that yet. And some of the objections, when we address those, then some of the parents will say, okay, well, I didn't think about it that way. And some of them have kind of come over. But on the brighter side, I do have a number of parents who have gotten their children fully vaccinated. And one thing I'm seeing is that some of the children in that age, where like early teens, are asking their parents to get them vaccinated, and they are the ones that are pushing to be vaccinated. I think that many of the children just want to get back to as normal as possible. So I'm seeing some silver linings or bright spots where children are asking for it, and others where I'm just kind of a little disappointed that I don't have as much uptake as I'd like to see. A little one came in the other day. She brought me a big box of cookies, and she ran over and she said, "I want to bring you these because guess what? I just got my COVID shot." And I'm going like, "Oh yeah, right." So that was fantastic. I actually took a picture of her doing that, and so she was thrilled about it. And I'm seeing some of the children actually want the vaccine. They've been seeing things on television whether they want it, but some of the hesitancy is still coming from the ultimate decider, and that's the parent.
So you'd say your perception is positive, but you're still cautious about the low number of patients who are interested in getting the vaccination.
That is correct. I think that one of the things that we see, if you're going to see like serious side effects with vaccines of any sort, and this goes all the way back to the beginning, everything that's ever been like a concern has happened in the first roughly 2 months after mass distribution. And if it doesn't happen in 2 months, you got a safe vaccine. And so what I'm looking at there and hoping that as time goes by and the thousands of children that we have, that will serve as a reassuring measure to parents to say that, okay, we've been doing this for a while now, and that, we're not seeing these serious side effects you're worried about coming up. So therefore, it's time to get your child vaccinated. So I think that, yes, I would say hopefully optimistic that as time goes on, will actually decrease because of the sheer numbers, because of the numbers nationwide that we're seeing get vaccinated.
So it's interesting you say that because I think that's probably one of the primary issues that people have, especially in our community, is what's going to happen a year from now if I take this vaccine? And they think about all the lawsuits that we hear on TV, the commercials. If you took such and such a drug and, are having complications, call our law firm. So it's very important to distinguish, as you said, that this is not, vaccines are different from other medications that people take. And if you see a problem with a vaccine, it's going to happen sometime in the first, 8 to 12 weeks. Whereas medicines that people are taking for a prolonged period of time, those may have ramifications a year, 2 years, 3 years down the line. And that's different from what we're going to see here.
Yes, that's definitely different in that the mass administration of vaccines has been going on for quite a while. They're tested and they're safe, and they because they don't actually hit the market until they're safe. But even once the level 3 trials are done, and then you get distribution to literally millions of people, the observations still go on. The observations of what and follow up of any type of side effect still goes on. Some years ago, there was there was a vaccination against rotavirus that came out, and this vaccination, this particular vaccine, was an oral vaccine. They gave the vaccine, and then they saw some cases of a certain intestinal complication that they thought might be related. Pulled it right away. And so because in vaccines and things like that, you kind of shoot first, ask questions later. So they just pulled it. And they later did extensive work on it and found that maybe a small percentage of that particular complication could occur. It never saw the light of day again. So it's not like, that you're going to be out there and you're seeing all these complications and just kind of keep giving it. But there are things that we have wiped out because vaccinations were given, and any time they seriously investigate whatever could be a potential side effect. But if we look at the last numbers of ones that's been introduced, Haemophilus influenza type B, a particular one that was causing meningitis and killing children every year in 1985, it's gone now. A particular one that caused meningitis, like 2004, pneumococcal vaccine, we gave that to 2, 4, and 6-month-olds. That particular infection is gone. So vaccine administration to mass numbers of children is not new. It's just great. But I've been around long enough. After 40 years, you've seen some of these illnesses just flat out disappear.
Yeah.
I have a question related to myocarditis, Dr. Yancy.
Mm-hmm.
So
yes.
There was a report today, kind of shed a little bit more light on the incidence of myocarditis. It stated that it's at least 4 times more likely to occur after a COVID-19 infection than it is after a vaccination, and that heart inflammation is more likely to develop after a COVID-19 infection than following a vaccination. I'm sure you've explained this here before, but could you help put this in perspective for some folks?
Sure. There's a mild inflammatory situation that can occur in an extremely small number of usually young men. I think between between 15 and 35, where you get a mild inflammation of the heart muscle. It is generally self-limiting, goes away within a few weeks, and does not. There's been no reported cases of like long-term complications from it. So if you took a football stadium and filled it with 100,000 young men between the ages of, let's say, 15 and 35, and gave them all a COVID vaccine of this particular mRNA vaccine, then you would probably get somewhere around somewhere 2 and 3 that would possibly get this. We're talking a stadium filled with 100,000 folks. Okay. If, on the other hand, you take the same 100,000 folks and you immunize none of them, you give none of them a shot, then somewhere between 1,300 and 1,500 are likely going to get COVID within a certain period of time. And of those, heart inflammation is going to be much more common than related to the vaccine. Not only much more common, but more severe, and with the potential for long-term complications, which we have already seen. So, is there a slight risk, a tiny risk of complication like an inflammatory situation? Yes. Is it far, far safer to get the vaccine than to actually get COVID? Yes. Keep in mind, everything we do in medicine has a quote relative risk. Okay, there are people. Probably everything we do in life has a relative risk. Most of us who drove somewhere today got in, strapped our seatbelts on, and sat in front of our vehicle with an airbag and drove that airbag. In the course of human history, airbags have actually exploded and injured people. Okay, but it's far safer to have that airbag than not to have it. In the course of history, there have been people whose cars turned upside down, flipped and went in the lake, and they couldn't get the seatbelt off. Okay, so does that make seatbelts bad? No. It's just that we look at relative risk of things. So the relative risk is that if you're going to go somewhere, it's much more it's much safer to have the seatbelt on and be restrained in that vehicle than not. This is the situation with vaccines, that risking a wild infection, risking a wild strain of an infection is incredibly dangerous, because we don't have any idea what levels those particular complications will go to. So the vaccine is much safer. And even seeing in the hospitals now, the overwhelming majority of people with serious disease and serious illness are those that are not vaccinated. So yes, is there a small risk of almost everything we do? Yes. Is it a relative risk? And of what we, as a relative risk, much less? Then sure. The other thing that people kind of look at is, they say, well, this person got the vaccine and they, got sick anyway. Nothing, no vaccine has ever been seen to be 100%. But I will take the 95 to 98% so far as a protection against severe disease than not being vaccinated. It's just a fact. That's what it is.
Mm-hmm. Okay, let's jump into the audience Q&A. So we have a couple questions that we kind of pinged our audience to get earlier this week. And the first is from Jody Ireland, and she asks, my 11-year-old, who's 5'8" and 150 pounds, just got the 2 Pfizer shots for the 5 to 11-year-old group in November. He turns 12 on January 1st. Should he get the booster if it becomes available for kids under age 15? And if so, how long should they wait, since the initial 2 doses were much lower than an adult dose?
The waiting time would be the same. The booster dose waiting time after that would be the same. And right now we're looking at the 6 month actual the second dose of the initial series. And so yes, you should go ahead and get the one that's appropriate for the age at that time. So we've had a similar question asked. Well, my child is 11 and pretty good size. Can they get the adult dose? Right now, it's just that you get the dose that's age appropriate at that time. And if you actually straddle that fence where let's say you get the first one and you're 3 days before your birthday, and then 3 weeks later you're the next age, you get the one at that time. So that's kind of what we're looking at. And the effectiveness of the smaller dose in the younger kids still has been quite effective. So it's not exactly a weight height ratio. The effectiveness has been very good. And so if you're going to remain under the age and lower age group, you get both of those. You get the booster for the age appropriate one that you do. So I'd say for your child that's a pretty good size, but crossing that threshold, if he's 12 by the time the 6 months is out from that first one, go ahead and get the adult one. You're fine.
Okay.
Mark Fiddler asks, I would like to know what advice there is for adolescents an adolescent that had myocarditis, and if they should get a booster.
They're going to be looking at, this is something we're still kind of looking at, and it's difficult to answer that in a blanket statement, because it's going to depend on what degree. It's going to depend on what the cardiac findings are like there, and it's going to also that's one that I would say between certainly there's probably a cardiologist that follows the child. They're going to do some echocardiograms for follow up. That's going to kind of depend on how quick resolve, the degree to what it was, and what the heart muscle looks like now. So it's hard to say, yes, go ahead and get it. It's hard to say, no, don't get it. That's going to depend on what the cardiac picture looks like at that time. That's when it's going to have to be left to the cardiologist and the primary care physician who's actually caring for the child. So I'd say right now, jury's still out a little bit on that one. If you've had the two, you're still pretty well protected. So it's going to depend on what the cardiologist thinks of it. So those follow-up echoes at that point.
Gotcha. So you might have already sort of answered this one earlier, but Stephanie Daniel asks, will the 12 to 15-year-olds need the boosters? And I think she's probably referring to the recent FDA announcement that boosters are authorized for 16 to 17-year-olds. And so she's asking, what about the rest of that age group that got the vaccine earlier this year?
They're still looking at that. I'm sure it's going to actually come up to where they would, because it's also been shown that the booster is those who are boosted are pretty well protected against the Omicron variant as well. And so with that being the case, I'm sure that the recommendation is going to go down to that level to where we say, okay, yes, go ahead and get it. But right now it's one of those situations where I'm sure they're gonna watch the numbers, watch the trends. So I wouldn't necessarily, I don't think you have to line up for it yet, but because you're probably not 6 months out from, well, you couldn't be 6 months out from it anyway. But 6 months out from it, there will be a recommendation all the way down to there.
Okay.
Here's one, Dr. Yancy, that we get a lot, and I'm sure you get this as well. So this one is from Shelley King. She states that she fully supports the vaccine for most adults, but she wonders if it's worth the minimal risk in kids, since they very rarely get the symptoms from COVID. And you touched on this earlier, about individuals saying that kids don't get hospitalized from COVID, and I guess this is an instance of someone that has questions. Her kid actually had COVID last month and was and had very minimal symptoms, and wants to know if she should bother getting them vaccinated now.
I think there are two reasons that you should. Number one is that no one knows. In many cases, the second time around to get COVID, the second time around, is actually worse than the first time. So it's impossible to predict if your child has a second episode, how bad it'll be. The second thing is that we talk a lot about deaths. We've talked about that not many people, quote, die. Not many children, quote, die from it. What we can't get a good handle on, and there's many children who have lingering symptoms that go on for months. And one that everybody thinks is kind of a minor symptom is the loss of taste and smell, okay, or the change in the way things smell. We've had children who have had this prolonged, and they are suffering incredible depression because all their food and everything tastes like or smells like garbage. Okay, smells like or tastes like, and they'll explain it to you, old socks or anything like that. Well, they can't eat. And they just and so they've lost tremendous amounts of weight. They've become depressed because it's just they can't really consume any food. They have to force themselves to eat. And these are post-COVID symptoms, sometimes for long periods of time. So it's really not just the deaths. The other thing we've seen, and that those numbers are actually rising as well. We've also seen children who just don't have the endurance that they used to. Just last week, I saw a young basketball player, and she was pretty good, and she got COVID, and she now just can't play. She one or two trips up and down the court, and she literally has to sit down. This was a child who could play, three-fourths of a game or whatever, the usual rotations, but she can't play anymore right now. Now it's been a little over a month since she actually had COVID, and her endurance is just not back. So long term, there's still going to be some things that are potential complications that we don't know yet, and we're seeing. So it's still a good idea to try and avoid it if you can. The other thing, even though children don't may not be getting very sick to the same level of adults are, they still can be carriers, and they still bring it in the house. They still get other people sick with it, and it's been shown very well that if you are immunized, that you don't transmit nearly as much because you don't have the same amount of quote viral load. So you're not like spewing it out like somebody who has not been. So I think there's two reasons: to protect the ones around the children, and also to protect the children from long-term complications of actual COVID, which we are seeing, and that's a problem. Uh, and so far that other point I was talking about, where protecting people around you. Since the onset of this, there's some statistics that show that 140,000 children have lost either a primary or secondary caregiver. 140,000 children have lost a primary or secondary caregiver. Many of whom end up with relatives who let's face it, who didn't expect that they'd have to be raising a child, or in the foster system. And that's a reason right there to say, hey, let's see if we can get this out of the community, let's get rid of this thing, because children are losing parents right and left.
So we have a question about allergies. Liz Marie asks, or she says her son is allergic to amoxicillin and she's worried he will get an allergic reaction. Can you speak about the patient fears about potential allergic reactions?
Mhm. Well, first, let me say that on the and of course, it's very possible your son has a real significant allergy to that. So I'm not speaking of your son when I say this statement, but many people who have had quote allergies to penicillin are not allergic. Probably less than 20% are. Okay, they rashed when they took amoxicillin, and they were told they were penicillin allergic. But having said that, let's say you are allergic to it, and it's been documented that you're allergic to it. There's no components that actually match up with that. So what we say to any individuals who have had severe allergic reactions, what we call anaphylactic reactions, where you couldn't breathe, had to get epinephrine or whatever, we said, number one, check with your allergist or the person who's following you. Number two, check with your doctor. And then the third thing is, if they clear you to do it, I always recommend that they go to a facility that is going to give the shot, that where you can actually be there with somebody who is capable of, with resuscitation in case there is, some particular allergic reaction. I would not recommend going through the drive-thrus or the neighborhoods, the grocery store ones. Not for those children. If you had a severe allergy, you should actually, and you're going to get the vaccination. You should get it at a place where they are capable of doing medical interventions if you have an allergic reaction, and plan to stay for a while longer than the 15 or 20 minutes they ask you. Plan to be there half hour, 45 minutes, just to make sure there's no concern. So those two recommendations, three actually: talk to the allergist who's followed you, plan to be at a facility that, like a hospital facility, whatever, to give it there. And the third thing, plan to stay a little bit longer. These are not the ones I would do the drive-through vaccinations for.
Yeah, those quote unquote allergic reactions are actually adverse reactions, correct, Dr. Yancy?
Yeah, well, you mean the ones we're referring to that they've had previously? No,
Yeah, so like my
no.
son has been. They say my son is allergic to amoxicillin. They actually say I'm allergic to amoxicillin, erythromycin as well. And I always correct the nurse and say it's not really an allergy; it's just an adverse reaction to it. I get nauseous.
Yes, and a lot of people actually will quote have a quote allergy when it's really not an allergic situation. One of the things that for years, let's take for instance a particular illness little kids got all the time, roseola. Okay, so they would say they'd get roseola, and this particular virus gives you fever for about pretty high fever sometimes for about 3 days, sometimes into the fourth day. And so then the parents take them in, someone looks and says, oh, it looks like that ear's a little pink, so I'm going to go ahead and give you an antibiotic for that. They give them the antibiotic for, quote, one of these phantom ear infections, I call it. The next day, the child breaks out in a rash, okay? And so, but roseola, that's the nature of that particular illness. You get 3 days of a fever, then you break out in a rash. And so many children who actually took the amoxicillin and then broke out in the rash the next day, the parents think they're allergic to it, and they're really not. So the amount of actual allergies is probably somewhere around 20% of people who actually think that they got an allergic reaction, and it really wasn't. It's like another one. People talk about I'm allergic to milk, and what it is, they had a lactose intolerance. Okay, and he said, "Well, what happened when you drank the milk?" I got diarrhea. Okay, well, yep, they probably got a lactose intolerance, which is extremely common in African Americans, but not a true allergy when you look at the immunologically mediated allergic phenomena. Many people who think they are not.
We have another question from Stephanie Lovelace, and her question is about getting COVID in between primary doses. So her child got one dose, right, and then got COVID right away, and she wanted to know, does her child really need their second dose, and do they not have antibodies from also having gotten COVID?
That's an excellent question, and yes, I'm sure that your child did react with some degree of naturally acquired immunity after that bout with COVID. The problem is we don't know how much, okay, and the problem is we don't know how much and how long it lasts. So there certainly have been people who have gotten COVID twice within a certain period of time, which tells us that it's not 100%, and it's unpredictable as to when that natural immunity may wear off. So I would say that for the best protection, and then 28 days after that infection, it's reasonable to go ahead and get that other dose, because that will then boost whatever immunity you do have, and will certainly protect against a better against the second infection than just waiting on the natural immunity to take its place. We actually, as that immunity wanes, you become susceptible again, and sometimes the second situation is worse than the first. So yes, I would say after that, it's reasonable to go ahead and get it
done. Diane Bloom is asking about immunocompromised children because, the CDC previously offered some guidance on immunocompromised adults and, loosely kind of recommending getting a third dose if you're immunocompromised. And so she's asking, is that the case as well with immunocompromised children? And when should those kids be getting a third shot?
Okay. It would
if they need one.
Yes. Okay. And once again, there's some of those that we still just don't have a lot of really good data on. Almost every significantly immunocompromised child does have someone in that either immunology department or someone that's following them. I would say it depends on what their particular situation is. Immunocompromised kind of goes, it's such a broad term that it would be very difficult to answer that specifically. Now, if a child has, let's say, for instance, let's say you got diabetes, okay, you could be immunocompromised on that. But also, if you got something, severe combined immunodeficiency, what we call SCID, yes, you could have a certain one there. So it depends on the type of immunocompromising situation that you have. What we do know is that children who are immunocompromised from administration of medications such as anti-transplant drugs, your post-transplant patients, if they get a case of COVID, have a 1 in 3 chance of dying. Okay, so that we're talking that those transplant kids are really at risk. And so most of the transplant physicians are saying, okay, yeah, we can give you this, but we've given you things to suppress your immune system, so it may not take as well. So it's not so much a matter of complications, it's a matter of. So my thought is they are definitely going to be recommending third doses for them. But once again, it depends on the type of immune deficiency And I would definitely want them to get in touch with their doctor. That's one that I would not want to answer blankly.
Mm-hmm. As a follow-up, Kat Herring asks, would patients with autoimmune disorders and taking immunosuppressants benefit from or qualify for a fourth shot, especially if they got COVID after their booster?
Okay, let me get this right now. So you're asking about, you got COVID after the booster because you're immunocompromised, and they're asking about a fourth shot there?
Yes.
Yes, I have no data on that. It is very possible they will, but they're probably going to, that's going to involve them looking at probably tests for neutralizing antibodies and individualized situations. They're going to, before they, that would be kind of off label at this point. So they will probably look at drawing blood to look at the levels of antibodies present and whether or not they're still protective. And then drawing blood again down the road to kind of check on that to see. So that's going to be, once again, it's going to be an individualized situation, but that's going to kind of depend on them drawing titers and looking at neutralizing antibodies to see, you know, and various other antibodies subsets to see what's protective. And if they feel like they're protective, they're probably okay, but it's probably going to actually be a situation where they have to determine that on a one-on-one, case-by-case basis.
Yeah, so some of these situations you strongly suggest, or actually most of the situations, you strongly suggest that they speak to their primary care physician and the medical professionals who are in their circle to get the best advice.
That's exactly right. It's and that's one of the dangers of kind of like overall statements about everything that go to specific individual situations. You can't really say, when you use a term like immunocompromised, use a term like high risk, whatever. It depends on the individual situation and as to what's actually happening at that time. Now, logically, it would be that they would follow up, but when you get to like off-label use of things, and you say, okay, I think I'm going to give this fourth dose because it seems like it would be a pretty good idea. There's no data to really back that up, and so that would have to be something that you would want to talk to your own individual physician about. And I'm sure they'll want to do other tests to see how protected are you based on that. Yes.
We have another question from Brienne Sofel, who wants to know whether or not we know anything about long-term COVID. So what are you aware of in terms of studies that look at symptoms of COVID that persist or long COVID?
Well, we have looked at that. They have looked at long COVID in children. And the problem is you certainly can't look at real long COVID in children because you can't go longer than a couple of years. Okay, but we have seen children, as I kind of alluded to a little bit earlier, that certainly have been months out, over 6 months out from COVID, that are still having problems with being able to concentrate the way they once could, the old quote brain fog type of thing that has been present in some children for months. We also have a decrease in, an increase in chronic fatigue. We have an increase in children whose endurance is not what it once was, and we have as I also mentioned, a situation where children are still having trouble with confusing the senses of taste and smell. That's actually going on. And there's various psychological and retrainings and all sorts of stuff that have been done there. And we're talking months out. There's also children who some weeks out will develop this, multi-system inflammatory condition where you just get all sorts of organ systems involved in a very severe inflammatory situation with persistent fevers, organ failure, kidney failure, things like that. That some of the listeners may have heard called MISC. That's a complication of it, although kind of not long term. It certainly happens a while after the actual infection. That's one of the more severe ones. But when you really look at it, I think it's pretty significant if a 14-year-old can no longer participate in athletics because they don't have the resilience that they once had following a COVID infection. And so we won't know some of these things until, maybe some years out, but we definitely see long-term complications and not over it in like 2 weeks and back to 100% normal like we should. This is one of the reasons why post-COVID, if there was a significant problem, there's some guidelines to return to sports activities, because we end up having to do EKGs on some, echocardiograms on others, because we know that these symptoms can be long-term, that can be complications that are long term. So if there was a child who had a significant case, I mean, significant fever, hospitalized, trouble breathing, the whole bit, and was pretty sick with it, before they can go back to athletic activities and things like that, they're going to require some degree of cardiac follow-up, because we know that can be a complication.
So let's see. We have some folks wondering about getting boosters earlier than the 6-month recommended timeline. There's Lori Clovis, and she asks, can I get the booster before it's been 6 months since my second Pfizer vaccine? I'm feeling a little worried about the variant, and I'm around college students all day. I can get my booster in 3 months, but is it okay if I do it before classes start again in January, even if it's a month early? I realize this isn't necessarily related to kids, but it could apply to my students.
I think what we have to do, and of course, those who certainly have studied, epidemiological studies, I have, but I think what we have to do in certain situations, we have to kind of go with what's been actually tested. Okay. It's really hard. I mean, a lot of things that sound like they would be a good idea, we don't have the data to say it is a good idea. And so what I always have to stay with now is the recommendation. And I think you have to still be as safe as possible. And you have to still do the same thing. I mean, one of the things that has no limit as to what you can do is wear a mask. I mean, you can wear those all day long. Okay. And you can wear them all day and all night. But I think we have to kind of stick with what the actual guidelines are. Once we actually kind of start getting outside the guidelines, it's tough then to evaluate both the effectiveness or the side effect profiles, because everybody's kind of doing their own thing. But I'd say if it were me and I was around a lot of young people all day, and I am, and around a lot of young people all day, I have had my obviously I've had my boosters at this point, but the other thing I did even before the booster was available, I had on 2 masks all day, every day, of which the children would come in and they'd laugh at me and they go, well, Dr. Yancy, why do you have 2 masks on? I'll say, because I talk to little ones all day whose mask is below their nose, and they go, oh, I'm sorry. They put it back up. So my thing is, I still think you take the precautions necessary, no matter what. The vaccine is not this major shield where there's nothing, like a force field where nothing can ever get to you. It's not designed to be that way, and it's not that way. So you still have to take those precautions. But until the recommendation actually comes down that says we're changing when you should get it, I have to go with the guidelines that say this is when you should get it. And I would just take all the precautions necessary before that time. And that is with masking and an appropriate mask, and distancing as much as you can. I think what happens with some people, they kind of get kind of lax with it and say, I've had that shot, and they sit and I know someone who got the shot and then sang next to somebody in a choir for about 2 hours in a concert. And this person wasn't vaccinated, and of course they were singing, didn't have a mask on, and this person got pretty sick. She was actually hospitalized. So if you actually, you can override the effect of something. If you actually just douse yourself in virus for 2 hours, I wouldn't depend on anything to keep you from getting sick at that point. So therefore, you still got to use the same barrier methods that we've been using for a couple of years now, until they actually say, yeah, this is the time to get it. I never recommend people doing things off label, because we just don't have the data to say this is what you should do.
Yeah, it's kind of crazy what's going on out here. And people fail to realize that there's no one-step process to preventing COVID outbreaks. It's really a a mitigation process, a mitigation strategy with several steps that are involved to keep everyone safe. And when we veer off of that strategy, things happen that bring us back to where we were in March of 2020, July of 2020, December of 2020. For instance, Cornell University has now shut down its campus due to a COVID outbreak. They had more than 900 cases of COVID since December 7th, which is only 8 days for people who are counting. Um, a school district in New Jersey just recently shut down until the beginning of the new calendar year because of COVID outbreaks as well. You know, Cornell has a 97% vaccination rate. Um, and we can't stress enough that being vaccinated is one of the greatest factors in preventing you from getting ill, severely ill, or dying from COVID. But is not the only step necessary. People have to maintain social distancing. People have to continue to wear their masks. And because people are not doing these things, we're seeing these large outbreaks. Should we go back to looking at closing down school systems for several months to try and prevent these outbreaks, or are we doing enough?
Yeah, I mean, I agree 100%. I mean, it's like, I mean, it sounds very simplistic, but, seatbelts and airbags are great, measures to actually keep you from getting killed or seriously hurt. But it doesn't mean that you can still go drive through every intersection, and
Yeah.
so it's one of those things where I think you still have to be cautious. It gives you the another layer of protection to keep you from getting seriously ill. But it doesn't mean that you can actually be reckless in the behavior and say, "Hey, I'm just going to go and, sort of have 2 hours worth of laughing and joking and dinner with folks who aren't vaccinated that I don't know in this particular crowd with no mask on, and say, okay, vaccine protect me." Everything has some limits, even from the very beginning. The vaccine was never touted to be 100% effective. Nothing is. Okay, no vaccine has ever been that. So you still want to, but it's extremely effective in the vast majority of people. So you still want to take those measures, just like you mentioned, that you still have to use the measures we talked about earlier on, to actually try to mitigate against some of that intense exposure.
Um, so we have a question from the chat, from our
Mhm.
Facebook chat. Doug, can you take that one? Can't.
Sure.
Let me type it in there.
Uh, here we are. So Tara BK asked about um, boosters after the J&J vaccine. She asks, is the single J&J plus a Moderna booster really sufficient, comparable to the others? No one seems to be studying that, and I'm feeling kind of half vaxxed right now. Um,
Yeah.
I I understand. Right now, the CDC does recommend just the booster, after a
Mhm.
single J&J vaccine, whether it's a Moderna booster or a Pfizer booster. And
Mhm.
it's not the case that no one's studying it. I mean, people are definitely looking at a lot of different combinations of boosters because that's what's happening. Some people are um, getting a booster that's not the same as what they got as their primary series, and so there are definitely a lot of eyes on it. But until there's something certain, that someone can say, okay, well, we've studied this and we can offer these recommendations, they're not going to do that. So my suggestion would be to get the booster, right, which I believe you have, and then it's not just that's not the whole solution, right? You still need to mask and social distancing and uh, the other public health measures that um, public health professionals have been recommending. It's a Swiss cheese approach to protecting yourself. vaccination is just one part of
Mm -hmm.
that. I hope that answers your question.
Thank you. Doug is our resident public health expert, so. We're going to transition to some questions kind of the effects of COVID on the reproductive system. So we had a ton of those, and obviously related to adolescent girls and young women. Let's see.
While you're looking at it, I'll just say, yes, that's been one of the questions that comes up. Will this affect, the ability to get pregnant or to stay pregnant once you're pregnant and things like that? So, almost everything that gets started has a starting point that's, well, I'm giving repetitive, that starts with somebody theorizing something. Okay, so, but you can't make the theory define. If you ask them, the question itself can't become the self-propagating answer or truth. It's the question that's there. So a while back, this one particular researcher says, the spike protein that's on the surface of the virus has some similarities. Particular protein that's on the placenta, okay, and this particular protein that's on the placenta, kind of looks a little bit like that spike protein. So the question was asked, I wonder if you have an antibody to the spike protein, will that actually cause you to actually reject the placenta and then you have miscarriages and stuff like that? And the answer is no. Okay. So it wasn't wrong to ask the question. The problem is once you prove that that's not the case, okay, then you move on from that and say, it doesn't do that. And we've had literally thousands of pregnant women, voluntarily get the vaccine perfectly fine. No increase in miscarriages and whatever. There's no mechanism by which the vaccine can sterilize it. It's no mechanism by which it can do that. And so therefore, this particular question was asked and got out there because of this protein that kind of vaguely resembles spike protein. And the answer is a resounding no. It doesn't have that effect. Now, if you look at the number of pregnant women who have come down with COVID, the actual disease, we know for a fact that does increase the likelihood of miscarriage, and some of them have been incredibly ill to where they've never seen their newborn because they're in an induced coma on a ventilator. And so pregnancy seems to be one of those particular high risk factors. So do we recommend vaccines during pregnancy and before? Absolutely, because getting the actual disease can be a nightmare, a disaster.
And there's the added benefit of, conveying some of that immunity to your child, right?
Yes,
So
that is correct.
And I think that's spot on, Dr. Yancy, in about the individual that initially asked the question, and I think that's a testament to how misinformation can spread a lot faster than the truth. And so it's really important that uh, that you get your information from reputable sources, which is why we have these to get it straight from people that have such a wealth of experience like yourself and can help answer some of these questions.
We have one on the screen now from Tracy JT, and she asks, some parents are resistant to vaccinating their young girls because of the rumors that women have had changes in their menstrual cycle after the vaccine or after contracting COVID. And the fear is that this change is apt to happen to younger girls, causing their periods to start before they should, or having interruptions. Can you address this and explain, like, scientifically, if this is possible and why not? If not, why it isn't?
Yeah. Well, the biggest thing to it was what I mentioned before was that the whole thing came up because of this protein that they thought resembled spike protein. But what you have to have scientifically plausibly is a mechanism by which something can occur. Okay, and so there's just no mechanism that can actually that can actually produce a situation where there would be an ovarian, a change, hormonal change that would give you that. And so it's hard to disprove what there's no mechanism for. And so that's why, folks, that's why a lot of things continue circulating, but you have to have a reason why that could happen. So if, for instance, I mean, I'll just you throw out if you get a spinal tap, you get a certain amount of spinal fluid to leak out, you get a leak and you get this horrific headache. Okay. And so somebody could say, I have this horrible headache because I got this spinal tap. Okay. You got the spinal tap, the fluid continued to leak out, you got this horrible headache. But then somebody walks up and says, I got this horrible spinal headache. And you said, did you have a spinal tap? Well, no. Okay. Okay. Well, there's no mechanism to give you. So you might have a headache, but I can't attribute it, to the spinal headache or spinal because you never had a spinal tap. So you have to have something that gives you a plausible mechanism where something could happen, or you could pretty much say anything causes everything. Okay. But that's why in science you have to have a pathway, a mechanism that it can happen. And right now there's no mechanism that we have that says it's going to, can change reproductive cycles or anything like that. There's just no mechanism for it. And so that's why it's one of the things that's out there as this quote, and it's not even a theory, but this talk that's out there with no mechanism for it.
Touching a bit briefly on maternal and fetal considerations, we have questions about vaccine side effects from Danny Cairns. Any idea of the long-term health concerns with fertility?
Well, that's what I was just kind of touching on. That no, they're now from a standpoint of COVID. If a child ends up with COVID and gets multi-systems disease, that's going to affect pretty much every organ. And so you could see problems from that. But once again, from the vaccine itself, there's no mechanism that shows by which you could come up with a pathway to get the fertility problems with that. But keep in mind, the same thing was said about some of the same arguments were made about the HPV vaccine, and we've now been, certainly a decade and a half or whatever into that, and it just didn't pan out because once again, there's no mechanism for it. And so, and then we do have a much longer track record with that. So no, there's no mechanism to show that this could in any way affect fertility.
We have an audience question about boosters for pregnant women, and we touched on this a little bit in the previous question, Dr. Yancy. So this one is from Genevieve McDaniels. She asks, what is the best timing for a pregnant woman to get her booster to pass some antibodies to the fetus? She's getting hers at 29 weeks, and she's hoping that that's late enough to convey some protection.
Yeah, it's really not been studied that well. We do know the best protection for the baby is for the mom to be protected at the most opportune time. And so, in other words, you wouldn't want to say, okay, I'm going to wait on my booster to get this, or wait on my shot to get this so it's closer to delivery time. Because if you end up with COVID during that time, your chances of having a miscarriage goes way up at that point. So recommendation has just been get it on time as scheduled, and that provides the best immunity cross-placental immunity for your child. So you wouldn't want to try to adjust it based on when you think you might deliver, because that could be dangerous.
So this question is fairly relevant since we've noticed several trolls on one of our YouTube streams. Maybe you can address some issues, some practical advice about misinformation. So Ryan Ferguson asks, what is the best way to fight disinformation? I've been encountering a ton of anti-vaxxers in the organic nutrition community, and despite being right on nutrition, it's scary how incorrect they are when it comes to vaccines.
Mm-hmm. Well, I think that, there are very few times when I say, we can certainly have a conversation about what are your views, and let me tell you why I think I might have an alternative view on that. But in some situations, individuals have decided what is the right answer and what is the correct answer, and they're not going to be deterred from that, no matter what you do. some years ago, an individual named Wakefield, okay, came up with this theory he had that immunizations, the MMR vaccine, cause autism, and that's been disproven 100 ways to Sunday.
The
But we still
unringable
have
bell.
yes, yeah, but we still have individuals who hang on to that. It's been shown by every single researcher that, I mean, who really looked at it critically. This is just not true, but we still have people who hang on to it. So what happens is, many times people like, very well-thinking people, but people like, there's a certain comfort zone in humans where we like a simple answer to complex questions. Okay, if you can get a simple answer to a complex question, then bang, you got it. Okay, and that's just not the case. So a lot of these theories come up with a quote simple answer to a complex question, and folks say, well, yeah, I like that because it's very simple. I can kind of go with it. When most complex questions have complex answers. So I guess that's a roundabout way of saying there will be individuals who never be convinced of something. What we try to do is explain the best science that we have and to say, this is why this actually works, and this is why this particular one doesn't. If you have a situation where nobody can reproduce your data, then you probably have a problem with your data, because all data in science should be reproducible. If I come up with something that says, if you take this pill, you will not get COVID, then I need a whole group of people who all took this pill, who never got COVID, but the same percentage who took it who didn't get it, then your pill doesn't work.
Yeah.
And so that's about as simple as I can put it. You have to be able to reproduce it. And if you can't reproduce it, then that means that there's something flawed about what that particular thought pathway is. I like to use, when I talk to patients, and I don't know how much time we got, but I'll just kind of run this through real quickly. If I say I got a cake and I can make a recipe, and that cake, I can bake it in 10 minutes and it's going to be fine. And then say, here it is. Here's my cake. I baked it in 10 minutes. See, I did it in 10 minutes. A chef comes along and says, give me your recipe. I give him the recipe. They put that in the oven for 10 minutes and he comes out soup. An international chef comes along and says, I put it in the oven for 10 minutes, comes out soup. 50,000 cooks, put that in the oven for 10 minutes, it comes out soup. Something's wrong with what I have presented, because nobody else can duplicate what I say I have done. So in these situations where we're talking about certain types of, yes, I agree with good nutrition. It's always good to have good nutrition, but good nutrition alone will not stop an individual from actually acquiring a deadly contagious disease. Because if it did, we wouldn't have had smallpox on the planet for 300 or 400 years, or however long it was. We wouldn't have had some of these deadly diseases around, because people would have said, hey, I'll just eat right and not catch it. But the people who ate right got smallpox. The people who didn't eat right got smallpox. And so it just was across the board. So when you look at the situation, there will be some, no, if I had a way to deter people who are just bent on believing the misinformation, I would be doing really well. But people tend to like simple explanations for complex problems, and that's very difficult to get past.
On that note, I just want a popular culture reference here. A lot of people out there probably watch the show 90 Day Fiance. It's one of the hits of reality TV these days. One of their alums recently passed away. His name was Jason Hitch, after battling COVID for 45 days. Jason was unvaccinated, and according to his family, he had no, and I want to underscore this, no pre-existing conditions. And he left himself open for being infected by COVID and suffering the worst consequences of it. And unfortunately, that's what happened.
Yeah.
I think, let me just throw this in. One other thing I was running. We've known for quite a while now, since the advent of tablets, of our electronics. We've known that when children get those at early ages, it delays their speech. Okay, it can have a negative effect on their eyes. It can have a negative effect on the possibility of developing attention deficit problems. These are things that are documented over and over and over. Yet and still, you walk into a restaurant and the 9/10 of the toddlers are sitting there with the tablet right in front of their face. We know it's bad. We know it's bad. And it's proven it's bad, but people still tend to do it. So many times it comes down to what you would like to believe and what you would like to do in the face of the science that tells you that. And when that's the case, it's very difficult. We know children's development of language and language skills is definitely affected negatively by phones and tablets, and we do it every day. And so why? It keeps them entertained. And so it's just sometimes the good science that you could present is just not going to be convincing enough.
Really quickly, we've had a number of people in the chat asking about infants and toddlers. We just heard Fauci a week or so ago say that we're maybe a couple of months off. So you think we're still on track to get those early next year?
I think so. Again, that's all I can do is say I think so, because it once again goes down to dosing and things like that. It's kind of tough to enroll a lot of infants to get huge numbers of infants in clinical trials, but a lot of them are going to end up being like doctor's kids or scientist kids. So yeah, put my kid in it. But yes, I think that the way the rollout is going now, the safety that's been proven in the kids that are a little bit older, I'd say we're probably still on track. But I'd probably add them, just speculating, probably a month or two to that, because they're going to make sure everything is absolutely fine, because there's so many other variables to look at: dosaging, normal development, and things like that. I mean, let's face it, a 5-year-old is pretty well developed, okay? But if you're looking at, they're going to have to look at a child who, many times children who have developmental difficulties, you don't pick those up until they're 5 or 6 or, until they're 10, 12 months old. Okay, he's, quote, not walking now. Okay, so there will be some other factors that have to be looked at to try and tease out what could possibly be related and what's just normal developmental stuff that didn't go as well. And that's why it's going to be they're going to be very careful with looking at neurologic situations in a whole bit, because it's a little bit different. That you're still looking at developing situations, and you're going to have to look at what is truly a side effect or what was just a time-related event that was going to happen anyway.
So, Dr. Yancy,
Yep.
can you offer us up some tips for this holiday season? How can we plan a safe holiday? Do people need to hold off on large gatherings again this year? What would you suggest?
Well, I'm going to go with the first one that's probably going to be, with some people, probably the most unpopular. And the best way to protect children during the holiday season is for everybody in their circle, in their household, in their realm, in their group to be immunized. Okay, all the ones that can be immunized to be immunized. That's the best way to protect infants and young children who can't be immunized yet from COVID. The best way. Now, if that's not the case, then I think that you really want to keep your gatherings to people who either that are vaccinated or whatever, because that then decreases that particular amount. So if they're not, I think at this point you have to seriously consider whether or not you want to go and be a part of that gathering. And if you're looking at a gathering of a large number of people who choose not to be vaccinated, and I've had patients who said this, we're not going to, and went dear, because so and so and so and so is not vaccinated, so we're just going to actually Zoom them. We're actually going to do the tele thing this time, and I think that's what you have to do. I said almost a couple of years ago, it's kind of not really a time for hurt feelings. It's a time to actually kind of take care of yourself. And so I still would avoid large groups for prolonged periods of time of unvaccinated people. Now, if you just have to go and grandma says, they're going to excommunicate if you're not there or whatever, then I still don't have a problem with masking. If it's going to be, if it's warm enough and you can do something outside, that's fine. You can limit your time there, but I have no problem with masking. I have no problem with masking. And if you're outside, yes, you decrease the chances. And if you've got unvaxxed people who are outside, the chances do decrease. They're still there, but they still decrease. And in a large group that was vaccine uncertain, I'd still have my mask on. 2 of them if I could. That's just the way I look at it. So how you gonna do the holidays? Carefully with individuals that vaccinated people that very carefully with people that you don't, with mask on if you just have to be there.
Can you leave us with your your thoughts on the progress that we're seeing, getting children vaccinated, getting our families back to being safe units for gatherings. Where do you think we are, and where do you think it looks like we're going to be getting to anytime soon?
I think we're making progress. I mean, every day I do talk to some who are vaccinated. We're making progress. So hopefully, with the vaccinated and some of the ones who actually will have some degree of immunity from the actual infection, we're kind of getting there. But the other thing is we haven't really gotten into the heart of the winter yet. Okay, and so it's tough to say, wow, things are really looking bright because we haven't gotten to the heart of the winter yet. And there's still a lot of other things out there. There's still flu out there. There's still respiratory syncytial virus out there, and this thing is going to have a tendency to kind of peak toward the heart of the winter. So we still got January and February to kind of get through. So I think it's looking up, and it's I think there's some light on the horizon, but I still think we still need to be vigilant, and because we still got the winter to come. And we still have that, And let's, while we're on that, let's just take the biggest problem is not having the booster. The biggest problem is not having the vaccine at all. Okay, so the boosters are great. Okay, that we definitely get, but what's driving what's continuing to go on is not the non-boosted; it's the non-vaccinated. That's what's driving it. And so, and we still got the winter to go through. So I'm looking up. I'm hoping that we have less transmission and everything, but we still got a couple of tough months ahead.
Well, thank you so much for joining us again. We love having you on, and we're really excited for all the things that we'll get to work on in the new year. But I just wanted to give our listeners a few quick ways to support Hood Medicine. And also grab some sweet gear. You can check out our bonfire store at bonfire.com/store/gorilla gear and grab a few HoodMed hoodies and some other goodies. And then also as a holiday present for us, take a quick second, visit our YouTube channel, and subscribe to be notified of future podcasts. And we will drop those links in the chat as well.
Thank you to America's pediatrician, Dr. Yancy, for joining us tonight. I can't thank you enough. You have been a wonderful addition to our unit, and we love having you on. The way you're able to break down this information for families is just remarkable, and that's why I really appreciate you. I tell Dr. Hudson often I am jealous that I didn't, and my kids haven't had a as awesome as you are. I just want to let people know at Hood Medicine, we want to bring you trusted individuals like Dr. Yancy to provide you with the facts and information to allow you to make the decisions necessary to keep you and your family safe. Please follow us on Facebook, Instagram, and Twitter to support our effort, donate to our cause, and find out about our next events. You can visit us at hoodmedicine.org or at hood_medicine on Instagram and Twitter, or Hood Medicine Initiative, all one word, on Facebook. Thank you again. Stay safe, and please get vaccinated and boosted if you're able to. Take care.
Thanks so much.
Thank you. Thank you. Thank you very much. All right.